Hi, John. How are you today?
Hey, Elliot, good. I would say since our last conversation, there's been a lot of activity regarding the potential for a domestic terrorism statute. There's been a lot of op-ed pieces, and so more to come on that space. And so I just wanted to highlight that. But been a couple of things from FinCEN that came out this week, and wanted to ask you about one particularly. There's one on PPP fraud, sort of FAQs, and people can look at that. But there was another advisory that I know you saw. We chatted about it on healthcare related fraud because of COVID-19. What were some of the things that jumped out at you there?
Well, big picture, what jumped out at me is, scammers are doing what they do. They look for flows of money where they can get in, disrupt them and redirect them to their benefit. And so what we're seeing, what FinCEN is talking about is a lot of healthcare related frauds that have occurred since the pandemic declaration, and the fraudsters are looking to access often federal funding, but also health insurance funding, to pay for non-existent testing, unnecessary testing, things like that. The release itself has 16 red flags.
Right. Yeah.
I think it would be valuable for folks to take a look at it. And as they're thinking about how they detect fraud within their customer base, and as they're looking at their transaction monitoring output, that they add these topologies in and, really see if they can focus, their efforts toward these types of scams. The interesting thing that caught my eye was that you might think of these as potentially being pretty small dollar, but as often happens in the FinCEN advisories, they also included several case studies from pending criminal actions, things that have at least gotten to the indictment stage. And one of them is a $30 million scheme perpetrated in New York through taking control of small pharmacies and using those pharmacies to be the fraudulent billers. And the other one was from California, and it was a medical technology company that spun up a $69 million fraud. So, again, we're not talking 100,000 here and 100,000 there. These folks are going for serious dollars, in kind of one big swoop. But again, in both cases, it was they had something to do with testing, and providing testing, but then fraudulent additional services that weren't required, didn't really have anything to do with COVID-19, but then were billed through to government programs. Bless you.
Thank you. That's a first for these.
Yes, well, and how appropriate when we're talking about healthcare.
Exactly, exactly. Sorry about that.
No, that's okay. So, to me, that's one thing. I mean, it's easy to say, oh, it's just a little more fraud, which I know our listeners don't do. But in an overwhelming environment, sometimes you do have to sort of say, okay, I'm going to try to go after the big ones. Well, these are often big ones. Now, in none of the cases that are talked about have we seen financial institutions taking a loss. So I don't think this is about a risk to the financial institution, but it is about detecting suspicious activity, which much of the suspicious activity that the industry does detect is not putting the industry itself at risk, but putting sort of the financial system at risk. So I think, these follow along there. And it was interesting. I mean, some of them I recognized as, oh, we've seen that fraud. It just wasn't healthcare related. The business being located in one place and all the clients, appeared to be located nowhere near them. So unless it's all telehealth, it's like, well, those people didn't all drive, 80 miles to get their COVID test, kind of a thing. So
yeah, and that all makes sense. The last thing I just want to mention before we close is I noticed there was a bunch of crimes that related to cyber. So the use of personally identifiable information. So whether it was a telefraud scheme or FinCEN also references identity theft. So they get personal information, then they use that to commit the fraud against the healthcare benefit program. So as we know in the AML space, cyber is a connecting dot, if you will, through everything. And so a lot of these frauds, obviously during a pandemic, people aren't in person, but more than normal, the use of technology to get personal information, to create false companies, create false clients, so that they can book some of these billing schemes. So once again, it makes so much sense to pay attention to technology and not to give up your information.
Yes, and I know that many financial services companies work really hard to educate their customers, again, including some of these examples. If you get a call from somebody about some healthcare services, do your best to verify that, they're the real deal and not just somebody trying to get your personal identifiable information.
Yeah, last thing we'll mention is FinCEN always says in these advisories, any of these indicators by themselves doesn't necessarily warrant a SAR, but obviously you factor that in your decision-making process.
Absolutely. So, and before we close, so it's FinCEN 2021-A001. So it's the first piece of official guidance on their website.
Right, exactly. And they have a link that you can go to a different website for additional resources to notify on healthcare fraud, waste, and abuse within Medicare, Medicaid, CHIP, or the marketplaces. So they give you a lot of really good information in this advisory. So, Elliot, stay safe, and thanks for all the information today.
No problem. Have a good weekend.
See ya.
Bye.